I'm Kyly Whitfield, an assistant professor in the Department of Applied Human Nutrition at Mount Saint Vincent University, and I run the Milk and Micronutrient Assessment Lab, the MAMA Lab. I wanted the MAMA Lab to be a place where we could do human milk research in Halifax, in Nova Scotia, in Canada, and internationally. I do some research in Cambodia, and I'm doing research here in Nova Scotia. All of the research that I'm doing is focusing on mums and their young children and trying to optimize feeding practices and nutrition so that those kids can grow and have the best outcomes. We have amongst the lowest rates of breastfeeding in Nova Scotia across Canada. In Atlantic Canada, about 1 in 4 women will breastfeed exclusively for 6 months, which is the recommendation from the World Health Organization. When you take a bit of a closer look into pockets of Nova Scotia, so for example in Cape Breton, we have even lower numbers, so maybe 1 in 10 will actually be breastfeeding exclusively for the first 6 months. We know that there's great health outcomes associated with that, and so I think it's important to try and understand why that's not happening. Is it a lack of education? Probably not. People know the breast is best mentality and kind of this mantra from public health, but why isn't it actually happening? Is it because mums have never seen someone else breastfeed, so it's a completely foreign idea? Maybe they tried to latch and it didn't quite work out. You can't just tell women to breastfeed. That's never going to work. You need to understand why, or what are the challenges? What can you do to try to address that? That's where we need to bring in support. We've got a really interesting study going on. It's a cross-cultural comparison to try and understand what does feeding look like in Cambodia, where breastfeeding rates are really high? What does breastfeeding look like in Nova Scotia, where breastfeeding rates are significantly lower? And are there opportunities for bi-directional lessons learned? What are these Cambodian mums doing that is kind of normalizing breastfeeding in their culture? What are Canadian mums doing that's maybe optimal that could be brought to Cambodia? And what's the opportunity there to learn from both cultures? So I've had a lot of support from Research Nova Scotia in the last couple of years. The Scotia Scholars program has been amazing. I've had the opportunity to bring so many high quality students into work in the MAMA Lab, so it's really neat to be able to bring students into that research and let them have these opportunities to collect data, analyze data, and actually to have the opportunity to look at data from different cultures. It's been phenomenal having these students in the research, and they're integral. If I didn't have these students helping to collect data, the research wouldn't happen.